I'm Mary Williams. I'm a pediatric dermatologist, and I'm going to be presenting a brief introduction to the ichthyoses. I'll use common language throughout, but I will also introduce medical terms that you will encounter as you spend time with your doctors or read more about these conditions. Next slide. The term ichthyosis refers to a large family of inherited skin disorders. They share the common feature of prominent scaling or thickening of the outer layer, the stratum corneum, over most or all of the skin surface. The presence of skin redness or erythema is variable. In some types, this redness can be very prominent, and in others, it is minimal or not present at all. Similarly, involvement of the palms and soles, called palmoplantar keratoderma, varies among the members of the ichthyosis family. Some of these genetic traits only affect the skin. These are referred to as non-syndromic forms, while those that affect other parts of the body in addition to the skin, these multi-system disorders, are referred to as syndromic. There are four major clinical types of non-syndromic ichthyosis. The first type, called autosomal recessive congenital ichthyosis, or RC. This type itself is made up of three clinical subtypes: lamellar ichthyosis, congenital ichthyosis, form erythroderma, and Harlequin ichthyosis. To some extent, these clinical subtypes occur along a spectrum, depending in part on the quality of the scales, large and plate-like versus finer and looser, and the intensity of the redness or erythema. This is a very heterogeneous group with respect to the underlying genetic causes. To date, 13 different genes have been identified which produce one or more of these clinical subtypes. All in this group are autosomal recessive traits, meaning that it takes two affected genes, one inherited from the mother and one inherited from the father, to manifest the disorder. Also, both males and females can inherit these traits. The next type, epidermolytic ichthyosis, often called EHK, is also genetically heterogeneous, with three different keratin genes that can cause this type. It is a dominant trait, meaning that one only needs to inherit a single affected gene or allele from either the mother or the father for this disorder to manifest. It's not uncommon, though, for a baby with EHK to be born to parents neither of whom are affected. This usually means that the mutation is new in the family and started with this baby. Epidermolytic ichthyosis is associated with fragile skin and a tendency to blister, especially in newborns, as we'll see in a moment. The two milder forms, Ichthyosis vulgaris and X-linked ichthyosis, are much more common in the population. Ichthyosis vulgaris is inherited as a semi-dominant trait, meaning that having one affected gene produces a very mild phenotype, manifesting usually as dry skin, while having the two affected genes produces a frank ichthyosis. Ichthyosis vulgaris often coexists with an allergic skin condition called atopic dermatitis. X-linked ichthyosis is an X-linked recessive trait. It only occurs in males. The mutant gene is on the female sex or X chromosome. Females have two X chromosomes, so they in most cases inherit only one mutant recessive gene from their mother or father and do not manifest the trait because they have another X chromosome which does not carry the mutant gene. Males have only a single X chromosome, which they inherit from their mothers. If they inherit the mother's mutant X chromosome, they will manifest the skin disorder. Finally, there are a few more non-syndromic types, as well as an ever-enlarging group of syndromic forms in which ichthyosis occurs as part of a multi-system disorder. In recent years, over 50 different genes have been identified that can cause either non-syndromic or syndromic types of ichthyosis. Thus, many genes, next slide please, can produce an ichthyosis condition when mutated. The term genotype is used to refer to the specific genetic change, which gene is mutated and how, while the term phenotype refers to how the mutant gene manifests, how they, for example, alter skin function or skin appearance. While the ichthyosis family has many genotypes, it has many fewer phenotypes. The many genes that produce the ichthyosis phenotypes alter how skin functions. They change the details of its structure or metabolism by a wide variety of mechanisms. But they all result in two common phenotypic features. First, all exhibit varying degrees of an impaired water barrier, meaning that ichthyosis skin tends to leak water to the atmosphere. This water barrier is arguably the most important function of skin, for we are about 70% water and we live on dry land surrounded by dry air. For most people with ichthyosis, especially older children and adults, this barrier problem can be easily compensated for by taking in more fluids and thus avoiding serious dehydration. And many, perhaps most people with ichthyosis may not be aware of their skin barrier problem. But their skin knows there's a barrier problem, and it senses that too much water is passing through it and escaping to the atmosphere. It tries to correct the problem by generating more layers of skin and making more stratum corneum. But because of its mutant gene, which is still generating a defective barrier, it can never completely correct the barrier problem. And so an ever ongoing cycle of overproduction ensues. Another way skin tries to fix its barrier problem is to call on the immune system for help. But this leads to inflammation and redness and often itch. The second common phenotypic feature of ichthyosis is the clinically obvious one of thickened, rough skin, termed hyperkeratosis, and visible scaling. This is the result of the overproduction of the stratum corneum combined with a faulty shedding mechanism. Instead of shedding the outermost cells as a single cell, in the ichthyosis, the cells remain clumped together and desquamate as large visible scales. This framework can help to account for some of the features of ichthyosis, such as a change in how the skin appears at birth versus afterwards, and also to understand some of the health problems facing people with ichthyosis. Next slide, please. Not all ichthyosis show up at birth, but those that do, the newborn's appearance, his or her phenotype, is quite different from that of the older child or adult. This change in appearance or phenotype reflects the skin's response to the dramatic change in its environment, from being immersed in the amniotic fluid of the womb before birth to exposure to the dry air after birth. As their skin adjusts to living in a dry world, its need for a water barrier becomes paramount, and the cycle of overproduction and inflammation begins. Take, for example, EHK as shown here. The thickened skin and scaling of epidermolytic ichthyosis does not develop until later infancy. Instead, it is the fragile skin component of this type of ichthyosis that manifests in the newborn, with widespread areas of open skin produced by the friction and trauma of birth. Only later do these babies develop the characteristic EHK phenotype of hyperkeratosis and scaling. Skin fragility may still be present, but usually only as localized blisters or erosions. Next slide. Another example of a dramatic change in phenotype from birth to later on is seen in Harlequin ichthyosis, a subtype of autosomal recessive congenital ichthyosis, or RC. The Harlequin ichthyosis baby is born with an often disturbing appearance of thick plate-like scales that pull back the lips and eyelids. These tight, restrictive plates can impair the baby's ability to breathe or even feed. Deep fissures around the scales can provide a portal of entry for serious infection. These newborns need to be cared for in a highly specialized nursery. But if they can be effectively managed through this fragile newborn period, The thick restrictive scales will be shed and replaced by a phenotype of redness or erythroderma and looser, flakier scaling, resembling congenital ichthyosiform erythroderma or CIE. Again, these changes reflect the response of skin to a dry environment with attempts to repair a defective water barrier, producing overproduction of epidermal cells and triggering inflammation. Next slide, please. Using this framework, let's consider the problems that individuals with ichthyosis may encounter. Chronic barrier failure triggers release of chemical messengers or cytokines that result in inflammation. They dilate blood vessels, producing redness or erythema, and they often generate chronic itch. In newborns with the more severe types of ichthyosis, barrier failure can lead to serious fluid and electrolyte imbalances. During the first year or two of life, these infants and young children can experience growth failure, falling to low centiles on growth charts for both height and weight. This growth failure is due in part to the calories that they can lose through heat of evaporation from a leaky skin barrier. And their increased requirements for both fluid and calories can be difficult to achieve with normal oral feedings. The thickened stratum corneum or hyperkeratosis can impair more mobility and over time can result in joint contractures. They can also obstruct sweat ducts, leading to failure to sweat and increase the risk of heat stroke. Similar obstruction of hair growth can lead over time to hair loss or alopecia. The thickened stratum corneum can also favor overgrowth of disease-causing bacteria and fungi. Fissures and blisters can provide a pathway for infections to penetrate deeper through the skin, leading to serious systemic infections. Babies are particularly at risk for this due to the immaturity of their immune systems. Changes in the skin's microbiome can also produce unpleasant odors, further burdening the lives of some with